Okay. A little bit of background on myself. I did spend 21 years in the Navy and the Navy Reserves, so I have seen what a good healthcare system does. The military is very efficient. I don't need a Z-Pack when penicillin will do for my head cold or for my sinus infection. I've seen what a very good and very efficient system can do. I've been with the city now for the past 7 years as of just the end of the month, last month. And the last 4 have been an elected official of the union, either a chief steward or the president of the union. Now, the way that our health coalition in the city of Portland works is management and the 8 different unions all sit down at a table and talk about ways to improve our health care or ways to lower our cost. No matter who brings it to the table, each one of us has a veto vote in how it goes. So usually what happens is the city's benefit manager, Janice Kimball, who's not here today, it's like herding kittens. The only one I've seen do it successfully was my border collie, but she couldn't do it. All it would take is one person to say no. We want to reduce people using the emergency room unnecessarily, so we want to raise the cost by $50 a visit. One union says no, it's all done. The union comes up and says, hey, we want to get rid of this thing because it doesn't benefit our people. The other unions say, hey, wait a minute, that's a good thing for us. We say no. Every 3 months we'd meet, every 3 months we'd go back to our membership and wait for the annual cost in health care to rise. Well, some of our members are members of one of our unions. They get paid in the $10 to $11 an hour range. And on the family plan, that's roughly a quarter of their paycheck that they have to put out to pay for their family's health care. It's getting to a point where it's very unsustainable. And then when a quarter of your paycheck's going out to pay for the health care, that $15, $20, $25 copay seems very expensive when you want to take your sick kid to the primary care physician. So you try to take care of it on your own. It's not a sustainable method. Well, in comes the Maine Health Management Coalition with Nancy Morris, of course. She's the one that came in and she successfully herded the kittens. We got a lot of extensive training in what costs are associated with health care. I don't think about it as a consumer. I go to the doctor, he tells me what to do, I go home. I'm good to go. Ex-military, so when he tells me your cholesterol's high, I am a negotiator too, so when he said you need to cut out cheese, I said, how about I go to lower fat cheese, 2%. We came to a mutual agreeable conclusion that it did work. A few months later, my cholesterol's fine, and I still try to watch my weight and watch my health. I thought I was being brought here as a model of health, but obviously that's not. What Nancy was able to do is sit down with us, transform us into a group that actually sits and works collaboratively. And without this health coalition in place, we'd have never gotten there. They're modeled a little bit about what the state does currently with their plans and how they work. They're talking to providers, they're talking to employers, they're talking to, and Portland is a self-insured employer, so there's a lot at stake there. Whenever health costs go up, it not only costs our members a little more money, it costs the citizens of the city of Portland more money. And from a union standpoint, if more money is being paid out in benefits, that's less union members we can get into our union. A city our size is supposed to have 4 to 5 electricians working on the traffic lights alone. We currently have 2. We can't afford it. And now we're down to 1 today. That poor guy, he's... Thank you, Doug. I know you're busy, so I'm not going to bother calling you and say, how's it going? Because I know the answer I'll get. What's important to do, though, is the important thing is to get labor's buy-in into this. What a lot of companies, what a lot of CEOs, and what a lot of benefit managers for even cities and whatever try to do is they all look at a new plan that would cut costs, and the first thing that comes out of their mouth is, well, labor will never go for that because to us, and to them it looks like to us, a view of loss of benefits. Anything that looks like a loss of benefits, I take back to my membership, they're going to vote no on. So what we have to do is come up with a collaborative approach that shows the benefits of what we gain out of it minus what we lose, and let people make an informed, intelligent decision. I know that going through this plan, I probably will lose my primary care physician, which is a guy I've trusted for years. He went to work for an insurance company. I went somewhere else for a while. When he came back and opened up his practice, I scooted right back to him. Very straight up doctor. He tells me, you need to lose weight, I go lose weight. It lasts a while. Not as often as I'd like it to, but it's one of these things that it's a very close relationship, but I know that because he's not probably going to be part of a patient-centered medical home. He does have electronic medical records, but I don't think he really wants to join up with some of these other practices it would take. Hopefully I can convince him in one of my visits to him. But I'm probably going to have to select a new provider. But at a lower cost and less cost for me, we're working on a plan that all your preventive stuff is taken care of, no copays. So that poor nurse's aide that makes $10 or $11 an hour, that pays a quarter of her paycheck for a family's health plan, she'll be able to at least not worry about the $15, $20, $25 copay when she has to take her child to the doctor, instead of waiting it to become a $50 or $100 copay to go to the emergency room. And what we're here for, and what this does, is it lowers the cost for all of us, thereby lowering the cost for not just our members, but the city of Portland and also the citizens of the city of Portland that pay our taxes. They want to see high quality at low cost. And we're not there yet. We've still got a long way to go with our negotiations. But we're moving forward, and we're trying to get it to a point where everyone can agree and we move forward and move into this. And honestly, without the Maine Health Management Coalition, and especially Nancy Morris in the back there, without this group, we would have never gotten there. So my thing is, if you are a CEO, or if you are in charge of a governmental organization and have a group of employees, make sure you engage those employees. Make sure you get these employees to buy into the new plan. And make sure they understand it's not just a benefit they're losing or a benefit they're gaining, but it's a benefit to all. Go ahead and spend the time to do the education. Spend the time to do what's right. If we all do what's right, and our doctors do what's right, and our insurance companies and hospitals all start learning to do what's right, whether by force or just out of the goodness of their hearts, we'll all get to a better place and we'll all be better taken care of. Thank you very much for your time.